Hi everyone, this is Dr. Alexina Metta here. I am currently in my office and just going live with you all. Hopefully we'll see some of you online. I announced this live video yesterday in my newsfeed and on Instagram. And it was prompted because I have lots of patients that have inflammatory bowel conditions, and I wrote a paper on it. So I thought, hello, welcome, Francis. I thought to, instead of just having this paper sitting, on my desk and in my computer, I thought to actually do a video, and this might actually turn into a couple of videos just to share some of my insights on what I learned when I was researching these two conditions from a medical perspective and from an Ayurvedic medical perspective. So for those of you who've never met me, I'm a naturopathic physician, nearly a decade in Vancouver, British Columbia, Canada. And I really love what I do. I absolutely adore meeting new people and listening to their stories and helping them feel better, feel more peaceful and happier and healthier overall. So as people come on, I will say hello. I'm very much into welcoming people in, and then if you have questions, you can ask them in the chat box, and I will do my best to answer them as I go. Okay, so what I'm going to do is I'm just going to be going through the actual paper, and if anybody's interested in the references, I do have a very extensive bibliography that I created in writing the paper, and I'm very happy to share that with you if that's something that you're interested in, finding out a little bit more about where the information came from and the research that exists out there. It took me at least 25 hours to write this paper, so it was a long, arduous process of sifting through the research, and here we have my ideas put together in a format that essentially I hope will help those of you who are listening. Hi Nina, welcome. Great to have you. Okay, so I'm going to start off with the medical etiology, and the word etiology means cause. So I'll talk a little bit about how, from a medical perspective, these two conditions, which are considered inflammatory bowel conditions, Crohn's disease and ulcerative colitis, how they are viewed. So from a medical standpoint, they're considered to be idiopathic, which generally means there's no particular one cause. And there are many different, oh, hi Joanne, welcome. Thanks for joining us. There are many different factors that contribute to the manifestation. So one of them is environmental, which can include things like the geography, so where people are living. So this is one of the factors that's considered to contribute to the cause, so geography. Cigarette smoking, and that should be no surprise, just with respect to the chemicals and the toxins and how that's going to affect the gut. Sanitation and hygiene. So these are the environmental factors that can contribute. Some infectious microbes have been found to contribute to the cause. Ethnicity, so that would be pointing to more of a genetic predisposition. And that leads us to the next one, which is genetic susceptibility, and also what's considered to be a weakened immune system. So these factors can contribute in the resulting mucosal inflammation that occurs. And again, everything that I'm saying here, every single statement, there's actually a reference for it, but I'm not going to be saying every single reference after every sentence because we'd be here forever. So again, if you're interested, just let me know and I'm happy to share those references with you. Hi, Victoria, welcome. Great to have you. Okay, so one of the widely accepted hypotheses in the cause of inflammatory bowel diseases is that in genetically susceptible people, commensal intestinal bacteria trigger an inappropriate, overactive, and ongoing mucosal immune response that mediates intestinal tissue damage. So this is one of the references, one of the statements that was made in one of the reference journals. It's been found, again, quote unquote, that individuals with inflammatory bowel disease have 30 to 50% less biodiversity of commensal bacteria in their gut compared to the norm. And it has been found that the loss of the intestinal epithelium play a main role in the pathogenesis of inflammatory bowel disease. Finally, it's been found that the changes in the flora of the gut is an important precursor to the development of the disease. Then we talk a little bit about the diet. So diet is another important factor that can affect inflammatory bowel disease. Hi, Julie. Welcome. Great to have you. So what's interesting about this is that it's been found that high protein intake, and that includes fish as well, not just meat, has been associated with the disease colitis in the ulcerative form. And considering that animal proteins have a larger amount of sulfur with amino acids, that can contribute to the pathogenesis of inflammatory bowel disease. And then we have also, in addition, with respect to nutrition and diet, the intake of animal and milk protein. So Crohn's is associated with an increased intake of omega-6 and 3. And then, of course, stress has been an associated factor. Hi, Stacy. Welcome. Hi, Nicole. Feel free to type your questions in the chat box, everyone. If you have anything that's coming up for you, I'd be happy to address all of your questions at some point, at least after the video is done or even during, depending on how much time we have. Okay, and then from an Ayurvedic perspective, and again, the references I can send to people, those of you who would be interested in learning a little bit more about where this information is coming from. It just takes a really long time to read out all of the references as I'm sharing sentence by sentence, because everything is referenced, every sentence in this paper. So according to Vasant Lad, who is a well-known Ayurvedic physician in North America, one of the main causes of inflammatory bowel disease is actually intellectual blasphemy. And this is called prajnaparada. And forgive my pronunciation for those of you who've actually studied Sanskrit. I've done my best with my studies in Ayurveda for the last 5 years, but I'm sure my pronunciation could be much better. And so what he's pointing to is that this perpetual ignoring of the wisdom of the body contributes to the pathogenesis of this disease, this inflammatory bowel disease, which again falls under the two main conditions, Crohn's disease and ulcerative colitis. Grahani is the term that's used to describe these two conditions. And again, ulcerative colitis has a little bit more of a specific name, but according to some references, both of these conditions are grouped under Grahani. So this is again from the review of the literature that is out there. So it's described as chronic diarrhea, sprue, and malabsorptive symptoms. Any vitiation or inflammation to this particular part by imbalanced doshas. So there are 3 doshas that we're going to be talking about, and they include Vata, Pitta, and Kapha. I'm sure most of you have probably heard of these before. And these can cause a variety of symptoms similar to Crohn's disease. So from an Ayurvedic point of view, it's a very different way of classifying illnesses. It's going to be based more on the movement or the lack of movement of the various elements in the body, in the various systems. Not so much based on symptomatology, which is how diseases are classified from a Western point of view, and even from a naturopathic point of view for the most part. So the degree and nature of symptoms may vary as per doshic predominance and involvement. So whereas from a medical point of view, the symptoms would be classified all in the same bin, from an Ayurvedic point of view, the symptoms would be classified based on the different dosha types and even combinations of dosha types. And we'll get into that a little bit more later on as we carry on. Hopefully you're finding this interesting. Again, if you have any questions, don't hesitate to pop them in the chat box there. So according to Ayurveda, when diarrhea is treated too soon, or if after treatment the patient is careless in diet, the result can be grahani. So this points to, again, the intellectual blasphemy that often diarrhea is treated incorrectly in systems that don't have the knowledge and the awareness of, say, traditional Chinese medicine, naturopathic medicine, or Ayurvedic medicine. Diarrhea is considered to be a natural response of the body to eliminate what needs to be eliminated because of some kind of a pathogenic, hi Glenda, welcome, some kind of a pathogenic process that's happening. And so we don't want to stop this process unless it's certain specific conditions or circumstances. There's always going to be exceptions, but generally speaking, this process is necessary in order to completely eliminate whatever pathogens are manifesting in the gut. So often this is treated too soon or treated incorrectly. And this can result in grahani occurring. So again, as I mentioned earlier, Ayurveda groups Crohn's disease and ulcerative colitis under the same classification, grahani, which is the ulceration of the small intestine. The effects of the ulceration can include what's called atisara, and again, this is another word to describe diarrhea, and udara roga, which is associated with abdominal pain and cramping. Also, ulcerative colitis can be correlated to the disease pravahika, which manifests in the form of ati pravahana parusha. Again, excuse my pronunciation, those of you who have studied Sanskrit. And so this can manifest in a variety of different symptoms, which include repeated defecation, watery stool, pain in the abdomen, sticky and frothy stool, and blood mixed with stool. So when we look at Kapha atisara or Kapha diarrhea, it can also be associated with colitis or correlated with colitis. And one of the research papers that I looked at stated that grahani is generally a Vata Pitta disorder. So this is considered chronic malabsorption syndrome. And then this can lead to ulcerative colitis. So hopefully I'm painting a picture here that it's not just one particular way that the illness can manifest. It can manifest in many different ways, depending on your constitution, depending on the instigating factors that led to the symptoms occurring. And then it can also change over time. So a disease state can start in one particular picture or symptomatology and then change and become something else. And so Ayurveda would take this into account. It would be much more specific in being able to assess where in the disease process somebody actually is. And finally, some causes from the Ayurvedic point of view include dietary extremes, so a diet that's far too complex or irregular, overcooked food, too many sweets, overeating or too much fasting, eating canned foods, junk food, or low vitality food in general, due to the excess use of purgatives or colonics, recreational drug use, antibiotic use, and stimulant use. And the causes of purisha vrudi, or increased feces, or the elimination of the feces, are numerous, and they can include liver and spleen dysfunction, malabsorption, dysfunctional Agni, and Agni is a term that describes digestive fire. Eating canned foods, oh sorry, I already said that. Chronic indigestion, eating large quantities of meat or heavy food, parasites like amoeba or giardia, and the suppression of natural urges to pass flatus and feces. So the suppression of natural urges is considered to contribute to these kinds of disease states. So this is not something that we typically will encourage, it's something that we're going to discourage. Okay, everybody still with me? How's everybody doing? We've got a few of you still on the call. Okay, hopefully good, you're still on, you're still listening. All right, so I'm going to talk, hi Diane, welcome. I'm going to talk a little bit now about the pathology of inflammatory bowel disease. So from a medical point of view, the primary factors contributing to IBD include genetic components, environmental elements, microbial flora dysfunction, and immune dysfunction. And there is a well-held belief that inflammatory bowel disease stems from a very complex relationship between genetic and environmental factors, as well as dysregulated immune responses and a dysfunction of the microbiome. Maintaining mucosal immunity is paramount to the health of the bowel wall, and a dysfunction of the cellular programs which maintain intestinal homeostasis can result in immune intolerance, inflammation, and epithelial damage. Current evidence points to dysfunction in the innate and adaptive immune pathways, which play a role in abnormal inflammatory response in those with IBD. There are two distinctive kinds of gut inflammation with both Crohn's disease and ulcerative colitis. You may have heard of these before. A Th1 response is associated with Crohn's disease, and a Th2 response is associated with ulcerative colitis. A variety of studies, hi Gabby, welcome. A variety of studies compared the gut flora of CD and UC, so Crohn's disease and ulcerative colitis, in both inflamed and non-inflamed segments. It was found that there is reduced biodiversity in the microbiome of IBD patients compared to healthy controls. Other research shows that the microbiota in IBD patients is less than stable than compared to healthy controls. Among the environmental factors which contribute to the overall pathogenesis of the disease, again, reiterating smoking, diet, drug use, geography, social stress, and psychological concerns related to stress. Smoking appears to be the most studied and significant contributor to inflammatory bowel disease. In addition, genetic studies have investigated the role of genetic predispositions and the relationship with microbial and environmental factors in mice. The disease course of Crohn's is identified by a sequence of flare-up episodes and remissions of varying degrees, and 10 to 15% have a continuous disease course. There is also systemic inflammatory manifestations, including arthritis, uveitis, aphthous and pyoderma gangrenosum. Okay, so now let's go to the Ayurvedic aspect. So illness is the end result of a long process which began with disturbances in the balance of the doshas. Grahani is a chronic disease explained in the classics. So he's referring to the Ayurvedic classical texts, which refers to disease which occurs in Grahani due to the vitiation of Agni, or the digestive fire. Further, it's explained that Grahani is included in the 8 major diseases, which is hard to diagnose and cure, according to Ayurveda. He states that, and this is referring to Baisha, one of the references named Baisha, he states, Jataragni rules the process of digestion supported by the 3 doshas. Grahani is a disease due to chronic imbalance of the 3 doshas, which impacts the function of Jataragni. In Ayurvedic literature, most disease originates in poor or incorrect function of the digestive system. Frawley further states that Agni is central to health and responsible for absorbing nutrients and eliminating pathogens. Undigested food can become like a pathogen in the body, resulting in an upset immune system, leading to ama, which is considered to be the buildup of toxins in the system. The main reason for digestive problems is connected to the Agni not functioning properly. The seat of Agni is known as Grahani. The relation between Grahani and Agni is similar to relation between structure and function. Grahani and Agni are interdependent. Functionally weak Agni, i.e. Manda Agni, causes improper digestion of ingested food, which leads to Ama dosha. The Ama dosha is a root cause of most diseases in Ayurveda. It has pivotal importance in the pathogenesis of Grahani. Ama then forms a thick coating as it adheres to the villi of the intestine. This ama and increased heat in the abdomen causes the vitiation of Kapha, resulting in the loss of snigdha, which is the oiliness and mucus secretions of the gut, in the intestines. As a result, mucus eliminated will be present in the stool. Gradually, loss of properties of Kapha leads to aggravation of Pitta. This initiates inflammatory changes and ulcerations, and these changes can result in bloody diarrhea. Long-term effects of this situation result in structural changes of the intestinal walls, which lead to the dysfunction in absorption. Hi there, welcome. Failure of absorption and impaired intestinal movement causes weakness, diarrhea, tiredness, weight loss, and anemia. According to another reference, Vata subdosha pranavayu becomes vitiated in the onset of Crohn's disease. Pranavayu is aggravated by the overstimulation of external stimuli and causes increased movement of the mind. Okay, so now we go into the mind-body connection. Then this upsets symptoms associated with Vata and Pitta. As disease continues, white blood cells invade the intestinal lining, and the result is inflammatory toxins, resulting in tissue swelling, injury, and ulceration. A Vata and Pitta prakriti makes an individual more prone to Vata and Pitta vikriti. Vikriti refers to disease state. Hi, Shauna, welcome. As Vata pushes Pitta throughout the digestive tract, normally, that's its normal function, or one of the normal functions, Kapha becomes vitiated to try to protect the mucus lining of the walls of the digestive tract from the dryness of Vata and the acidity of Pitta. As a result, Crohn's is considered a tridoshic problem, which is also known as Sanipatika, tridoshic gastric disturbance. At this stage of illness, symptoms can manifest as bloating, weight loss, constipation, diarrhea, ulceration of the digestive tract beyond the small intestine, high acidity in the gut, mucus in the stools, and loose stools. Okay, how's everyone doing? I know there's a lot of heavy language in this paper, so again, if you have any questions, feel free to type them in the chat box. So let's go through the symptoms from a medical point of view and then from an Ayurvedic point of view. So both Crohn's disease and colitis present with any of the following symptoms. So it can include diarrhea and stools, which can contain mucus, blood, or pus, abdominal pain, rectal bleeding, severe intestinal cramps, or muscle spasms in the pelvic area, bloating after eating, vomiting, weight loss, low-grade fevers, and fatigue. Abdominal pain may be the first symptom that people notice, and then the diarrhea. The nature of the diarrhea depends on the part of the small intestine or colon involved. For Crohn's disease, the stool is often porridge-like, whereas for ulcerative colitis, it is often mucus-like with blood. When fever is present for either Crohn's or colitis, it points to being a more dangerous expression of the disease. In addition, other diseases that are associated with inflammatory bowel disease can include non-thyroidal illness syndrome, arthritis, pyoderma gangrenosum, and even deep vein thrombosis. And from an Ayurvedic point of view, Some of the symptoms of malabsorption that they point to include, and these are things to watch for, variable diet, unpredictable digestion, poorly formed stool with undigested food particles and a foul smell, abdominal pain, emaciation. And then we can actually delineate between the different kinds of malabsorption symptoms in the 3 different doshas. So I'll talk about Vata, Pitta, and Kapha dosha now. So Watertight malabsorption can look like intestinal gas, abdominal distension, so that's bloating, migrating pain, meaning pain that's moving around. It doesn't stay in one spot. It's in one place and then moves to another place. Welcome, Chella. Good to have you. It can include dry skin, cracked tongue, anal fissures, hemorrhoids, chronic low weight with a tendency towards arthritis. Stool is watery, frothy, passed with noise or gas and alternating with dryness of stool, anxiety, faint feelings, and ungroundedness with low mood. So these are all symptoms of Vata type of malabsorption. Now we'll talk about the difference with Pitta type of malabsorption. This looks more like inflammatory kinds of symptoms. So inflammation in general, there's going to be more heat, ulceration, burning pain in the intestines, yellow diarrhea, anemia, anger, and irritability. So emotionally, depending on the type of malabsorption, it can manifest differently. And finally, Kapha type malabsorption, mucus in the stools, dull aching pain in the abdomen, heaviness and congestion in the lungs. There's going to be less weight loss with this manifestation and a tendency towards edema and diabetes. And actually, there is a 4th version, and this is called the complex grahani. In Sanskrit, it is called Sani Pataja. And this is more severe. The exhaustion is going to be more severe, and the stool is going to be pale or flesh colored with white particles. And you could have any combination of any of the symptoms that I just described in this more complex form. Okay, so then we're going to talk about now how the diarrhea can be different with the different constitutional dosha types. So Pitta diarrhea is going to be more yellow, foul smelling, mixed with pus or blood, burning sensation at the rectum, thirst, dryness, and possibly a fever. Vata diarrhea is going to be pain, cramping, and tenesmus, which can be cramping that moves, passing of gas, and frequent motions without too much stool being passed. And then you can have alternating diarrhea and constipation. And then Kapha diarrhea, whitish in color, viscous, and contains phlegm, feeling of heaviness, torpor, and lassitude. Motions are not as frequent and tend to have more quantity. Okay, how are we all doing? You're all hanging in there? All right, so I think I'm going to skip ahead. This is quite a long paper. I'm going to skip ahead to some of the treatments. And if anybody's interested in learning more about this topic, my office is in Kitsilano. I practice just above Whole Foods on 4th Avenue. So you're all very welcome to come and visit me, and happy to help you out if you are working through this type of ailment, inflammatory bowel disease. Okay, so treatments. So I'm going to talk about the medical treatments, then I'm going to go into the Ayurvedic treatments. And the Ayurvedic treatments are very extensive. And if you're not familiar with Ayurvedic herbs, a lot of these names are going to be completely foreign. It's going to be like a new language that you're hearing. But I will cover kind of hit the main points so that you just get a gist of what can be done. So medical therapies for both Crohn's and colitis are dependent on the patient. Some treatment involves the use of corticosteroids, immunosuppressants such as prednisone, TNF inhibitors, methotrexate, and steroids, which are used to control flare-ups. Again, this is all coming from the research. And again, those of you who are interested in the different studies that are out there, there's so many because this is a very common condition. Other treatments include anti-tumor necrosis factor antibodies, and when hospitalization is needed, including the use of blood and fluid transfusions and sedatives, when hospitalization is needed, there can be the use of blood and fluid transfusions and sedatives. In some cases, surgery is required in the form of a proctoectomy or total colectomy. In addition, nutritional therapy can play a role. A low-fiber diet, diets rich in B vitamins, fat-soluble vitamins, iron supplements, and minerals like magnesium, zinc, selenium, and essential fatty acids are also recommended, according to Charlebois, 2015. Prebiotic and probiotic therapy have been shown to also help treat IBD, and there are negative effects of various medical treatments listed above. The use of prolonged antibiotics can be harmful to the digestive system, and with the use of steroids, there is an increased risk of cardiovascular disease, infertility, renal disease, and liver disease. And with blood transfusions, there's a risk of infection and a hemolytic reaction. Ayurvedic treatments. If ama is present, so again, remember ama is the buildup of toxins in the system, and generally that will be happening with any type of inflammatory bowel disease. That needs to be removed from the body. So the approach is going to be to remove the toxins or the ama from the body. Methods that fall under the category of Lungana karma can be used. These are lightening treatments that lighten the body, and there are many different kinds of Lungana karma treatments that can be used. The focus of the remedies are going to be Deepana and Pakana. Often these are taken with Gurta, so this is ghee. Ghee is often used to help eliminate ama. Other methods used include, and I'm not going to say this properly because I do not know how to pronounce it, but it's spelled K-S-U-T, so kasut, something like that, which is avoiding food. So this can be a treatment. Hi, Rosa, welcome. Trit, which is avoiding water. Vyama, increasing physical activity. Atapa, exposing the body to direct sunlight. Maruta, exposing the body to direct breezes. So again, this is all coming from the Ayurvedic literature. Diet therapy is also given in the form of a graduated diet over several days or weeks with an avoidance of kapha-producing foods like flour, dairy, greasy food, too much meat, sweets, as an example. Diet management and panchakarma are also recommended in treatment. So panchakarma is a series of different treatments and diet therapy done over at least 12 days, depending on who you speak with. I think the longer that you can do the panchakarma treatment, often the results are better. Furthermore, mental relaxation is important. Welcome, Debbie. Good to have you. Mental relaxation is important for the treatment and also will help prevent further remission. In fact, it is important to reduce stress by Dev Prashaya, which is mantra, and yoga karma. So this is recommended in the Ayurvedic system, is to address whatever symptomatology or illnesses that people are going through, not just on a physical level, but on the mental, emotional, and obviously spiritual levels, because Ayurveda is eminently spiritual form of medicine, as well as physical and mental and emotional. It addresses all of these areas because as human beings, we have all of these areas that are part of us, and we cannot separate ourselves from any of these aspects of ourselves. According to another source, Grahani entails chronic diarrhea, sprue, and malabsorptive symptoms, and is divided into 4 categories of treatment: Vata, Pitta, Kapha, and Sanipata. So again, earlier I spoke about how we can classify based on the different doshas, and then the treatment is going to be given based on how the illness is manifesting in the particular person. So some of the recommendations for a Vata character Grahani include the use of carminatives. So these are herbs such as Ella, Yavani, Hingu. Some of you might know that as Hing, Datifalum. Digestive herbs such as Pipali, Chakraka, Jeerikam, and anti-diarrheal herbs such as Bilwa fruit, Karpura Sava, and an Amram seed, which comes from mango. It's roasted in a fire and taken over a day in divided doses 2 or 3 times a day. So I'm not going to go into the highly specific aspects of how to use their herbs. I'm just wanting to give you an overview that there's a lot that can be done, and just to inspire you that this is something that you might want to consider if it's something that you're dealing with, or if you know someone who's dealing with it, that they know that there are options for them, that just because they have had symptoms for a long time doesn't mean anything other than that. There's always another day, another opportunity to try something else, and you have nothing to lose. It's really the message that I have for all of you here today, is that if something isn't working, try something else. Never give up hope. Always keep trying, and you just never know when you're going to turn a corner in your health. And if you stop trying, then you stop allowing those possibilities to come your way. So keep showing up and keep trying. And it's wonderful. It's one of the reasons why I decided to study Ayurveda, is that I really love learning, and I really love knowing that there's more that people can do. If one particular system or solution isn't doing the trick, why not learn about something else and see what other people have done? For thousands of years, all across the globe, people have been addressing their health issues. So if in one culture you can't find your solutions, go look in another culture. Go see what the people have done there. There's always been medicine people, people who were connected to spirit, people who are connected to the plants, to the herbs, to the people, to the heart, to the emotions, that were just listening for the wisdom and the guidance to know how to help people through their various health ailments as they arose in their lives. And everybody is going to be susceptible to something. There's, I don't know a single person that doesn't have something within their health that they're dealing with, and that's just a part of life. So keep going, keep trying, never give up. So that's my little spiel on that. Few other possibilities. Let's see here. I have about 3 pages worth of treatment. So let's go to, okay, Pitta Grahani. So some options for that. Again, unless you've studied herbs, you may have not heard of any of these terms before, but Musta tuber, Heriverum plant, Kira tacticum plant, Kutaja bark, Bilwa fruit. So again, lots of options. I've got about 20 things on this list, so I'm going to skip ahead to the next one here. And then we have Kapha. So Kapha Grahani can be treated with some different remedies, such as there's a herb here called Dania Yapanachakam, and that's more effective if given with Rasa Churna and anise tea, for example. Okay, so I think I'm going to stop there. I feel like I've been talking for a really long time, and I see that we don't have any questions right now, but thank you so much, everybody, for listening. I hope that you found something helpful and inspiring and useful out of what I've shared today. I've pretty much just been, just kind of reading through the paper here, for those of you who showed up a little bit later on in the video. And yeah, let me know how it touched you. If you have any questions, let me know. Again, my office is just above Whole Foods on 4th. You can go to Dr.Alexina.com and find me there. And totally honored to support you in your health and well-being. It's truly a pleasure, and just wishing you all the best. So have a beautiful day. I can't believe it. I've been talking for 39 minutes to a computer screen. And all of you beautiful people who've been listening here today. Thank you so much. Have a wonderful day, and we will hopefully hear from you or talk to you soon. Thanks.